Welcome to the Deep Dive.
Great to be here.
So today we're tackling artificial intelligence in healthcare. It's definitely a hot topic.
It really is. You hear about these super smart algorithms, maybe diagnosing things, helping doctors out.
Right, but it also feels a bit, sci-fi. Maybe even a little concerning for some people. Are we talking helpful tools or something else?
That's the core question, really. We've been digging into it, and, well, the potential is definitely there. Think faster cancer detection.
Okay, yeah.
Or maybe virtual nursing assistants available 24/7. And even getting treatment plans tailored just for you.
Moving away from that one-size-fits-all approach.
Exactly. So our deep dive today is trying to figure out, is this mostly a boost for healthcare, or are there serious potential downsides we really need to watch?
Got it. Okay, let's start with the good stuff. What's looking promising right now?
Well, faster cancer detection comes up a lot. It's a huge potential win.
Absolutely. Catching things earlier makes such a difference.
And those virtual nursing assistants you mentioned, the idea is they could handle routine questions, maybe appointment scheduling.
Freeing up doctors and nurses for the more complex stuff.
Precisely. Plus, that move towards customized treatment, tailoring things based on individual genetics or lifestyle. That feels really powerful.
Yeah, like medicine finally catching up to the individual.
We even saw reports about radiologists finding AI genuinely helpful, like a second pair of digital eyes looking at scans.
That makes sense. Sort of a safety net, maybe?
Could be. And practically speaking, AI doesn't get tired, doesn't call in sick. It's just there.
Yeah.
Consistent.
Okay, that consistency point is interesting, but there has to be a but, right? What about the downsides?
Oh, definitely. The big one is accountability. What happens when an AI gets it wrong? A misdiagnosis, a bad treatment recommendation?
Who carries the can? The hospital, the software developer, the AI itself.
That's the million-dollar question, isn't it? And it ties into the data these systems learn from.
Right, the training data.
Yeah, think about using, say, medical data from decades ago. Healthcare knowledge changes, populations change. If the data is biased or outdated.
The AI's decisions could be skewed. Or just plain wrong for certain groups.
Exactly. We saw a discussion around how historical data might not reflect, everyone equally. It can introduce bias.
And legally, can you sue an algorithm? It feels like the law hasn't really caught up yet.
It's murky territory for sure. Then there's privacy. These systems need vast amounts of really sensitive health data to work.
Yeah, protecting that has to be absolutely critical. A breach there would be catastrophic.
Huge implications. And there's another risk. Over-reliance. Just trusting the black box without fully understanding why it's making a certain recommendation.
Or what happens if the system goes down? Or encounters something completely new it wasn't trained for?
That human element is still vital, isn't it? That intuition, the ability to handle the unexpected.
And we have to remember, humans build these things. We program them, so human error or oversight can creep in. Forgetting to account for certain patient groups, perhaps.
It's definitely possible. So when you step back and look at the whole picture, AI in healthcare feels like it could be a major turning point.
For better or worse.
Well, that's the debate. Will it make good healthcare more accessible to everyone, kind of democratize it?
Or could it actually widen the gap, between those who have access to the latest tech and those who don't?
That's a real concern. And what does it do to the actual patient-doctor relationship? Does it feel less personal if there's an algorithm in the room?
Yeah. Does it change how we interact with doctors, how we think about getting care? The whole experience might shift.
It's a lot to think about. Our sources paint a really complex landscape. Huge potential benefits, speed, personalization, efficiency, but also really significant hurdles, accountability, data issues, privacy, keeping that human touch.
So no easy answers. It sounds like cautious optimism might be the way forward. Be excited, but also very aware of the challenges.
I think that's fair. It really pushes a question onto all of us, onto you listening. As this tech becomes more common, how do you feel about AI playing a role in your health decisions compared to the way things have always been done?
Something to definitely mull over.
It is. It's a conversation that's really just getting started.